All right. Good morning. How are you?
Good morning.
All right. Thanks for meeting with me this morning. So you and I are already pretty familiar with each other. You have been at the Orthopedic Clinic for me for almost a year already. It's crazy how fast time has gone. So talk to me a little bit about what you were doing with Orthopedic Clinic.
Well, when I started the orthopedic clinic, they just had me floating around, just helping and assisting wherever that was needed. Within a month, they realized they needed somebody at the work comp department. So for the past 7, 8 months, I've been at the work comp department. And when I started there, I was helping with billing on the
Okay.
work comp side via DWC 25. I was dealing with the adjusters, asking for them, and or I was processing the claims for the billing. And then as time went on, they also needed me to assist in doing emails, phone calls, registering new patient, as in new work comp patients,
Okay.
and and that was pretty much it. And I was assisting Miss Karen.
Okay.
Miss Karen is one of their top orthopedic coordinators. She's been there for over years, and I guess she was just falling behind, and they wanted me to assist her as much as she needed.
Okay. Awesome. And then you were also with Halifax Health for quite some time as well, prior to coming to Ronstadt. And you were there as a patient access specialist. So talk to me about what your day-to-day operation looked like there.
Well, at Halifax, I was at the emergency department, and then in the emergency department, we had plenty roles. Either we are at the front desk, getting well when new patrons come in with an emergency, we'll be the first one that they will talk to, give us their complaint. We would generate a wristband for them so they can be seen by the doctors and the ED. And then we also had a role where we would meet them at bedside, where we would collect demographic information, their address, phone numbers, their insurance card. And then on the back end, we would also call and verify insurances to make sure that everything would be paid.
Okay, perfect. Yes, and I see that you have it pretty well spelled out on your resume as far as obtaining the authorizations and then kind of making sure the medical records are going through the proper wavelength. So that's perfect. And the final thing I wanted to ask you about that's not on your resume is when you go into your next role, what is one thing that you are looking for?
Well, I'm looking for a possibility for growth for myself. So with this position, I would hope that, in the future that they would bring me on because I do have a family that I have to provide for. So that would be a great opportunity, and this new role would be absolutely phenomenal. And I'm ready for a new challenge.
Perfect. All right. Awesome.